As a physiotherapist, chiropractor, or osteopath, if a patient walks in your office complaining of back pain, headaches, recurrent sporting injuries, which also includes scoliosis and other typical complaints, do you simply look at their area of complaint? Do you consider other reasons why they have these symptoms? Are you looking outside the box? Or are you focused purely on where the patient is complaining of? Do you know how the brain and body are connected, and how the brain, including the vestibular system and the cerebellum, can directly influence the spine and other musculoskeletal conditions? Hi, my name is Dr. Carlo Renato. I'm a chiropractor from Sydney, Australia. It's a great pleasure that I'm going to talk to you about today our upcoming series, NeuroConnect. It's a 4-part series that will be kicking off in Hong Kong in March 2019. It's a 4-part series. Module 1, which is what I'm going to talk about today, is all about the foundation. It's all about connecting the dots. It's all about you understanding how one area of the body and brain are connected to other areas. Because if you can understand this, you'll be in such a better position to be able to understand when someone walks in to go, oh, you're complaining of back pain. But the reality is because this area, maybe in your brain, maybe in the cerebellum, maybe somewhere higher up, is not working well. And because of that, you're going to complain of musculoskeletal symptoms indefinitely until we can fix that underlying problem. Now, it's cool when you can have that discussion, but to start, you need to have knowledge. And Module 1's all about that. Module 2 is about how to perform that assessment. Modules 3 and 4 are all about the main conditions that are going to walk in the door, from spinal related to pain related. So, Module 1's all is about showing you, or maybe opening up your field of view and looking at patients with a different lens. Someone comes in with a shoulder problem. Do you just run to the shoulder and do your assessment and that's it? Or do you look at other areas that relate to the shoulder? This is all about that mind expanding moment where we can go, oh, the brain does have an influence here. How much of an influence is it having? What can I do to assess that? And what can I do to apply therapy to that part of the brain as it relates to the spine? And it's really cool when you can start doing that. Because ultimately what we want you guys to do is get better results. We want you to retain your patients or refer on when required, don't get me wrong, and also be a referral source, because when you become the go-to person, everyone in your local area or family and friends of patients will be going, this person is the person you should be seeing. Okay. Now let me show you a couple of examples here. So when we look at this person, what do you see? Hopefully you can see that the pupils are a different size. What does that mean? What's the importance of this? Most of us will see people with altered posture, forward posture, head tilts, leg length discrepancies. How do you explain that? What does it mean? Does it mean they've got a problem with a hip joint? Does it mean they've got a problem with their C1? Does it? It may not. It could be a vestibular problem. It could be a body awareness problem. Their body's compensating to this skew inside their brain. You don't know that, but we're going to show you how to do that. Okay? When someone has hyperreflexia, when you do a muscle spindle reflex testing, what does that mean? Are you just thinking of an upper limb or an upper motor neuron or a lower motor neuron sign? Or is it something more subtle, something a bit more functional in between? All right? When you see someone's face drooping like this, what do you think of? Are you thinking Bell's palsy? Or are you thinking something more cortical that could be changed, that may have changed, and it's now changed the motor aspect to the cranial nerve? Maybe, maybe not. Okay? When you look at the palate, when you look at the back of the throat, you look at someone's throat, what do you see? Are you thinking purely cranial nerve? Or are you thinking brainstem integration? You're thinking ways in which I can influence that. By looking at this, what's this person's gut function going to be like? What's this person's stress adaptation going to be like? It's cool when you can look at something and then you can apply it in different ways. Because remember, without knowledge, what you're seeing is just purely seeing something. It's not an observation. All right? Knowledge is king, and we're going to get you to that point. And Module 1's all about that. Details of the seminar: we're located in a great center, in a great rehab center in Hong Kong, in very central Hong Kong. We presented, this is a class that we held in August in 2018. It's a purpose-built clinic. It's got multiple rooms that we can practice and learn and apply the new knowledge that we have. We've got some great neuro rehab equipment that we'll be able to use and see how to incorporate that into a practice. But understand, we've only got 20 spots available. Okay, so space is very limited. We have a very early bird up until the end of this year. Once that's gone, that's it. We'll go into early bird prices, but take advantage now. We've got some great specials available. If you go to www.brainhubacademia.com.au, you'll see these prices. We've got some great additional savings if you were to register for all four modules at once as well. I look forward to seeing you in Hong Kong in March 2019. Bye for now.